Did you know that something as simple as how you breathe could help protect you from pneumonia? Respiratory training strengthens your lungs, clears mucus, and boosts your immune defense naturally. In this video, we'll explore easy and effective breathing techniques you can do daily to improve lung health and lower your risk of respiratory infections. Let's breathe better, stay stronger, and protect our lungs, starting today. Pneumonia is a serious respiratory condition that can affect people of all ages, especially the elderly, individuals with weakened immune systems, and those with chronic lung diseases. Fortunately, one effective and natural approach to help prevent pneumonia is by improving lung function through respiratory training. Strengthening your lungs can boost your immune defense, improve oxygen exchange, and help clear mucus and pathogens more effectively. Here are practical respiratory training tips to enhance lung health and reduce the risk of pneumonia. Practice deep breathing exercises. Deep breathing is one of the most fundamental and effective techniques to improve lung capacity and oxygen exchange. Shallow breathing, which is common during illness or sedentary lifestyles, leads to poor ventilation in the lower lungs, where infections like pneumonia can easily settle. How to do it? Sit or lie down comfortably. Inhale deeply through your nose for 4 to 5 seconds, allowing your belly to rise. Hold your breath for 2-3 seconds. Exhale slowly through your mouth for 5-6 seconds. Repeat this 5-10 times 2-3 times a day. This technique promotes lung expansion, improves circulation, and helps remove stagnant air and mucus from the lower lungs. Incorporate diaphragmatic belly breathing. Diaphragmatic breathing trains the diaphragm, the main muscle of respiration, to work more efficiently. It's particularly useful for people with lung conditions like COPD and asthma, and can help prevent respiratory infections by improving lung clearance. Technique: place one hand on your chest and the other on your abdomen. Breathe in deeply through your nose so your abdominal hand rises while your chest remains still. Exhale through pursed lips and feel your abdominal muscles contract. Practice for 5-10 minutes daily. Use incentive spirometry breathing devices. Incentive spirometers are handheld devices often used in hospitals to help patients avoid lung complications after surgery. They can also be used at home to promote deep breathing and lung expansion. How to use? Exhale normally, place the mouthpiece in your mouth, and seal your lips around it. Slowly inhale as deeply as possible, aiming to raise the indicator on the device. Hold your breath for 2-3 seconds, then exhale. Repeat 10 times, ideally every 1-2 hours when awake. This tool can prevent lung collapse, atelectasis, and help clear mucus, reducing the risk of infection. Engage in regular cardiovascular exercise. Cardiovascular exercise like brisk walking, swimming, cycling, or dancing promotes in better lung ventilation, strengthens respiratory muscles, and boosts overall immunity. It also helps increase your aerobic capacity and oxygen delivery to tissues. Recommendations: aim for at least 30 minutes of moderate intensity aerobic activity 5 days a week. Include short intervals of increased effort to challenge your lungs. Always consult your doctor before starting a new exercise regimen, especially if you have existing health conditions. Pursed lip breathing for airway clearance. Pursed lip breathing helps keep the airways open longer, promoting easier breathing and better mucus clearance, especially helpful for those with chronic respiratory issues. Steps: inhale slowly through your nose for 2 seconds. Purse your lips as if blowing out a candle, and exhale slowly for 4-6 seconds. Use this method during physical activity or whenever you feel short of breath. Stay hydrated and practice good posture. Proper hydration keeps your mucus thin and easier to expel. Additionally, good posture ensures optimal lung expansion. Drink at least 8 cups, 2 liters of water daily, unless advised otherwise by your doctor. Avoid slouching. Sitting or standing tall allows your lungs to fully expand. Periodically, stretch your chest and back muscles to prevent stiffness that can restrict breathing. Cough effectively and avoid suppressing it. Coughing is a natural way to clear mucus and irritants from the lungs. Learning to cough properly is essential in preventing infections. Technique: take a deep breath. Use your abdominal muscles to produce a strong, controlled cough. Avoid shallow, frequent coughs. They can be less effective. Respiratory training is a proactive way to enhance your lung function and build resilience against respiratory infections like pneumonia. These simple yet powerful exercises, when practiced regularly, can improve breathing efficiency, clear mucus, and support overall immune health. Combine these habits with good nutrition, adequate rest, and regular checkups to protect your lungs for the long haul.